My nephew called me a few days back and told me he had malaria. And I went, Mama, I want a medicine. I have malaria. And I was like, how sure are you it's malaria? He said, I feel it's malaria. And I can differentiate between all these other diseases and malaria. And I was like, okay, I agree it's malaria, but still, let's go for a blood checkup before we buy medicine. Why did I insist on that? It's because I grew up in a home where my dad was so health conscious. He never at any moment bought medicine without taking you for a blood checkup. Yeah. So growing up, that's the routine I knew. Like, you have to go for a blood checkup, be sure of what's really the problem before you buy medicine. So when he called me, I was like, okay, let's go for a blood checkup. We went for a blood checkup. After it was true, he had malaria. So this doctor gave us the results and said, you go to the pharmacy and buy this medicine. And he said, when you buy this kind of medicine, take it before eating anything. Don't eat anything. Take it on an empty stomach. And we were like, okay. Be sure to take it on an empty stomach. And we were like, okay. So we went to the pharmacy, bought the medicine. So the doctor wrote the directions and said, eat food, drink well, then take the medicine. We were like, doctor, are you sure? He was like, yes. He has to eat and drink before taking the medicine. If he doesn't eat, it's going to affect him, and it will make him more weak. So it will be better for him to eat and drink before taking the medicine. These are two doctors, same medicine, different directions or prescriptions. Why am I bringing this story is most of us have this tendency, okay, we trust doctors completely. We know they know what they are doing, you know. When I go to a hospital or to a pharmacy to buy medicine, I know this doctor knows what he or she is doing. They're educated, they're experienced, you know. So when the doctor gives you directions on how to use medicine, we do not question them. We do not doubt them. You just go and do exactly what the doctor said. Now, I'm making this video to ask you people to start reading the directions in these medicines. So I have a lot of medicines, some medicines here, especially most of these are the syrups, because I have a baby at home. I have babies at home. So I want to show you that in all medicines, there comes a piece of paper which gives us everything, all information we need to know about the medicine. Maybe the doctor hasn't given it time to read the directions in this medicine. So this is Ibumol, or you can call it ibuprofen syrup. This is Amoxidec. There is what? A piece of paper. There is a piece of paper. And on this piece of papers, not only are they giving you the right prescriptions for this is Bactoclav. I want to show you that in all these medicines, there are these papers that we do not read. You see, all these, there's like you can't open a box or a pack of medicine and there are no directions. There is directions. And there is something that caught my attention that most of us are not giving attention. Most of us, when we feel like I have malaria, you send someone to the pharmacy to buy you a certain type of medicine. And the pharmacist will ask, is it an old person or a young person? And this person will be like, oh, it's my mom, or it's my auntie, or she's old enough, she's a mature person. Then the doctor will write 2 times 2, or 4 times 1, you know. They won't ask if the person has any kind of condition health-wise. Yet in reality, there are warnings and precautions on these pieces of papers inside these medicines. Yeah? There are warnings. There are people who are taking, someone can say, oh, I have cough. This cough has stayed for long. And then the doctor gives you Bactoclav. Yet in reality, there are warnings and precautions here. They are talking about pregnancy. Like if you're in a situation of pregnancy and lactation, there is message for you. Interactions with other medicaments, these information, undesirable effects, information, overdose and treatment. You need these warnings, darlings. You need this information. I've been at least I think I've met only 3 doctors who you go to, you ask for a particular drug, and they get this piece out and read on it before writing on the medicine. It actually, I was buying syrups for the babies, and I realized this doctor, for them, they could check this before they read. In all this, now this is an flu syrup. In all these medicines, there are these pieces of papers we don't give attention. Huh? This is vitamin C. Let me see. This is vitamin C. See, every medicine. This is Expect. It's a cough syrup. See, there is a piece of paper to give you directions, to caution you, to warn you, and everything you need to know about this medicine. Why am I saying this? Why do we need to read these pieces of papers, all this information in the medicines we buy? It will help us know the right dosage and how often we have to take it, and how long to keep it. How to keep it, actually, because some medicines, once open, they are not supposed to be kept for long. I bought syrups for children, and they're like, after 5 days, throw it away. So for you, buy this medicine, and that doctor maybe hasn't said it, and you haven't read it, so you keep the syrup. Every time the baby is sick, you bring out the same syrup. Every time the baby is sick, you keep it for a month. It has already become poison. It has become poison. So it is so important for us to know the instructions in these papers. It's not there for decoration. And just in case you can't read it, because not all of us are blessed to be in position to read ourselves. Just in case you can't read, you might be having someone at home, or maybe your child who can read. But just in case they can't read, question the doctor more than once. Doctor, are you sure? If it's you, a hubby, buying for your wife medicine, are you sure it won't affect my pregnant woman? Are you sure? So that just in case the doctor hasn't read this, and because even some of these medicines are advanced by the day for the betterment of our health. So you can find that the doctor is following old directions that were used for these drugs. Yet in reality, maybe they advanced it to a level that it's not to be used by pregnant women. So let's our health matters. Our health really matters. Any kind of special information or special instructions is always written in these papers. Let's not put our lives at stake. Let's not take our lives for granted. You might be there. You're a lady. You've been looking for a baby for years and years. So God has blessed you with a baby, and now you feel you have malaria, and you just sent for medicine. You haven't told the person you have malaria. You've just sent to a pharmacy. So let us be more careful. Let us be more careful about our lives. I'm giving this information. It's all about. I'm giving this information, and I'm sure it's about making us, take the right amount of medicine at the right time for best results. Take the right amount. Because you find that some doctors have even subscribed wrongly. Otherwise, do not hide and say, just in case you have a problem when you're misinformed about the medicine you are buying or the situation you are in. Otherwise, that is it. And thank you for watching Elma's Corner.